Levothyroxine is the most commonly prescribed medication around the world to treat an underactive thyroid. But why is that? Are there any alternatives? If it's the most appropriate medication for you, then how do you ensure you get the most out of it? If you don't know the answer to all those questions, then you've come to the right place. Not only will I be going through levothyroxine, why you take it, when you take it, how you take it, I'll also be answering a number of quick-fire questions, including a little bit about weight. I'll also discuss an alternative medication I bet you haven't been offered, as well as my information tidbit with something I bet you never knew. Hi, I'm Lawrence and I'm a GP, and you're very welcome. Nobody wants to get sick, and nobody wants to take medications unless they absolutely have to. And I get that. All medications come with side effects. It's a matter of weighing the risks of taking the medication versus the risks of not taking the medication. More on this in a little while. Today, I'll be giving you reliable information based on UK and some international guidelines, and I will link all the details of these sources below. The aim of today's video is to leave you with the power of information to make informed decisions. To answer this, let's just super quickly go through what I'm actually talking about. An underactive thyroid, hypothyroidism. Remember, that's the gland, the thyroid gland, that sits in the neck when it's not producing enough thyroid hormone. And that hormone's responsible for metabolism, the breaking down and burning of energy, which happens in every single cell in the body. And this slowing down of the burning of energy translates to you feeling slowed down, lethargic, tired, gaining weight, feeling depressed, skin changes, hair changes, the list goes on. And the universal treatment for this is with the medication levothyroxine, which is a man-made version of our natural hormone, thyroxine. The theory being, if you're missing the hormone, the treatment is replace that hormone. The very quick answer to the question who should take it is everybody with overt hypothyroidism. That means people who are struggling with symptoms and also have evidence on their blood tests that their thyroid hormone is low. If your thyroid hormone is low, the only thing that's going to make you feel better is raising your thyroid hormone. The trickier decision is in subclinical hypothyroidism. This is where the thyroid is functioning okay, but it is struggling to achieve the levels that we need, but it is achieving them. It's like looking at a car. If your car is going at the speed you want, the slowish speed of say 20 miles an hour, but you have to put your foot to the floor just to achieve that speed, something's gonna give. Probably. And so if you know it's going to break down at some point in the near future, why wait? Shouldn't we just fix it now? So this might sound obvious. So if you've had it before and had issues with it, especially if you've been allergic to it, if you have other certain hormonal conditions, especially ones that affect your adrenal glands, or you currently have an overactive thyroid, and also sometimes if you struggle with heart disease, levothyroxine can ask your heart to speed up, and that may not be a good idea, or at least that things should be started a little bit slower. So the general agreed recommendation is that you take it first thing in the morning, on an empty stomach, before you take other medications. And here's the reason why. Number one, there's some evidence that it can keep you awake at night, hence the morning, but also because it guarantees number two. An empty stomach gives it the best chance of being absorbed into the bloodstream because we know that food and caffeine, especially within 30 minutes, can reduce your ability to absorb the drug by about 20%. And number three is because certain medications affect the absorption of levothyroxine. So two ways: you should start feeling better, and your blood tests should improve. Levothyroxine starts working straight away, but it can take several weeks before you feel a little bit better. But most people do. There are, however, a small number of people who don't feel better on levothyroxine. A bit more on this in a minute. The blood test, TSH, is repeated usually between 6 and 12 weeks after starting the medication or after a dose change, and it's because it can take this long to see an effect. Once stable, the blood test is usually repeated every year just to make sure things are stable. My info tidbit, in case it's applicable to you. The vast majority of the time, we tell patients that the generic version of the drug, with the ingredient levothyroxine, is the same as the brand version of the drug, which also contains levothyroxine. It just tends to be cheaper, is all. But there are studies that show that in some patients with hypothyroidism, if you change from one brand to another, they start to experience symptoms of an underactive thyroid that only improve when they go back to their original medication. I'm not exactly sure why that is, but it may be an option if you've switched medications and your body has become a bit upset by it. Quickfire round. Life. Just take it whenever you remember it, unless it's getting close to the next time you have to take your tablet. Don't take two very close to each other. Speak to your doctor urgently. No. Speak to your doctor. Yes, but drink responsibly. If you're gaining weight because you had an underactive thyroid, yes, it should make you lose weight until your hormones rebalance again. Once your hormones have rebalanced, you're as likely to lose weight as somebody who doesn't have an underactive thyroid and isn't on levothyroxine. If you continue to lose weight, that can indicate that maybe something else is going on, or maybe you're on too high a dose of levothyroxine, but either way you should speak with your doctor. So, decision time. Remember I said it's a matter of weighing the risks of taking the medication versus the risks of not taking the medication, with the risks of taking it. Top of the list, side effects. Here they are. But wait a minute. All of those side effects are symptoms of an overactive thyroid. If you think about it, levothyroxine is imitating the body's natural hormone thyroxine. So, if your dose is too high, it may feel like you have an overactive thyroid. And if it's too low, it may feel like you've got an underactive thyroid. So the side effects of having too small a dose you'll be familiar with because they are the symptoms of having an underactive thyroid. And having too high a dose is causing your body to metabolize and burn energy out of control and might give you side effects of feeling anxious, heart beating fast with palpitations, bowels going a bit quicker, weight loss, hair changes. And the way we manage these side effects? Alter the dose of the medication, controlling your thyroid hormones to the right level. The other risk of treating hyperthyroidism, well, it's more a risk of over-treating it. If you over-treat it with too high a dose of levothyroxine for a long period of time, it can increase your risk of an irregular heartbeat called atrial fibrillation, which can put you at risk of strokes. It can also increase the risks of osteoporosis, a thinning of the bones that increases the chances of breaking a bone if you were to fall over. But if it is monitored at least every year, that should prevent these complications. Then, of course, there's the risk of anaphylaxis, which is a severe allergic reaction, which is very rare, but is always possible with any medication you put into your body. So they're the risks of treating. What are the risks of not treating an underactive thyroid? Well, if you just have a thyroid that's struggling with subclinical hypothyroidism, not treating that could lead to an underactive thyroid, overt hypothyroidism. It's a different story not treating overt hypothyroidism. This isn't a case of just leaving you feeling a bit miserable. It can cause real complications. It can increase your risk of getting a goiter, which is a swollen thyroid, and that can affect your talking and swallowing. It can cause your bad cholesterol, LDL, to rise, and this increases your chances of heart attacks and strokes. It can cause numbness, tingling, and pain in the nerves. It can make getting pregnant very difficult and pose risks to your child if you're underactive thyroid during pregnancy. Very rarely, if it was very severe, it can cause a rare complication called a myxedema coma. So, my opinion, it's riskier not to treat it. So there is one. Remember I said this earlier, which is a man-made version of our natural hormone, thyroxine. What about the other hormone? If thyroxine is the man-made version of T4, then liothyronine is the man-made version of T3. And in fact, T4 gets converted in our body to T3 because T3 does the heavy lifting. It's T3 that's responsible for actually increasing our metabolism. So why not just skip the middleman? Plus, liothyronine works quicker. Well, it's not a definite no to taking liothyronine, but it's a probably not, at least initially. And here's why. None of the research has conclusively shown that liothyronine is better on its own or in combination with thyroxine compared to levothyroxine on its own. Number two, there are more unanswered questions about liothyronine. We're not as familiar with it, so better the devil you know. Number three, let's be honest, price. And number four, levothyroxine tends to be better tolerated with fewer side effects, and it also works more consistently for a long period of time. Liothyronine works quickly, but it wears off quickly. Now, all that being said, a small number of patients on levothyroxine achieve good-looking blood results, but still feel unwell with symptoms of an underactive thyroid. A very small proportion of those, for some reason, do feel better when they switch or add in liothyronine. But the evidence at the moment, by and large, says that it's no better on its own or with levothyroxine than just levothyroxine on its own. But this is an area with ongoing research, so maybe that will change. And so that's it. Remember, everything I've said here today is for informational purposes only and shouldn't be considered individualized medical advice. Disclaimer down below. But thank you very much for watching. I appreciate your time, and until next time.